Remember, when you are in a session, I hate to say there are two of you. There's a professional you and there's a real you. So there's always a tension there, right? When sometimes your professional you, your real you is a professional you. But sometimes, like normally you might discuss emotion or other thing, but you don't want to bleed all over the client, right? So you just have to control yourself. Remember that now you're a professional, so there's always tension about how make sure that your real self does not interfere with your professional self. Ideally, your professional self and the real self will be exactly the same, okay? But it's often not the case. So therefore, spontaneous self-disclosure must be monitored. You cannot just give an example, okay? Suppose you have gone through a clinical bout of depression or severe depression. Now you're working with a depressed client. Should you tell her that, you know what, I too have gone through that struggle? Is it appropriate or not appropriate? How many people say it's appropriate? No?
I think there's so many variables, it depends.
Yeah, okay. Okay. Just generally speaking, you're a person, you're working with a client, some depression, and you have gone through the same thing. It's appropriate to say, look, I have gone through the same thing. Is that appropriate?
How would it help the client?
Yeah.
Huh? The client is struggling with depression.
No, I don't think it's
It won't be
helpful
helpful.
to say that, no.
It is helpful.
Not generally.
I think in some situations, I like the
Yeah.
we, but.
Yeah,
But from my perspective as a client, I have depression. I'm looking for someone who's going to help me to walk out from the depression. If the therapist is in depression, what kind of outcome I can expect?
not including
No,
it. I'm overcome.
In there.
Overcome. Oh, okay. I thought
Depressed right now, so it's like.
No, I think that the client, depending on the point in therapy where that comes up, I think the client could benefit in that if you have overcome it, then there's hope I can overcome it. So, yeah.
There's no right or wrong answer, okay?
Right.
There's no right or wrong. I mean, you can, there's no right or wrong answer. It depends on your personality. It depends on the case, okay? Personally, I don't see anything wrong. As a way of encouragement, I say, look, I've gone through the same thing. I've overcome. Using this method, I think this will help you too. So in that sense, so my purpose of disclosure is to give them hope, right? Encouragement. On the other hand, if I tell the person all my troubles and all what, that's too much, right? That say, I come to see help. I don't want to hear all your miseries, all the days of misery, right? So you have to be wise, right?